Okay, tonight we will talk about selecting an appropriate research design. Just let me share my screen. This is for the week 7 in research, and we have here the first slide. Let me just flash it. Okay. So we have here the research. We all know that no design is perfect, and the researcher can predict some threats that will require attention during design, and others may arrive unanticipated in the midst of the study. The design process entails a series of decisions, balancing research rigor with reality. So we have here two perspectives in selecting an appropriate design. We have the macro perspective. Okay, when we say the macro perspective, okay, macro decisions are among the first to be made, and but each large classification of studies encompasses numerous ways to conduct the study. Dealing with these choices requires a micro view. So before we could decide for the macro perspective of what particular approach we will be using, we should have at least what in mind is micro perspective. So we have to know what particular design from that approach is to be utilized in that study. So both the macro and micro views of research design are focused on one outcome, and this is answering the research question with the greatest credibility or the greatest level of credibility. And this is one way of reflecting on this overriding purpose that could guide the researcher in the decision that must be made. Okay, so we have here the basis for design selection. Ultimately, the basis for selecting a design is or are the demands of the research question. If a research question has been carefully considered and purposefully constructed, then it could be matched to a specific design. And this match between well-constructed question and best possible answer is the goal of the research design process. We also have here the nature of variables. The nature of variables of the study may keep the ethical researcher from manipulating the environment or the treatment situation. These ethical limitations are strong influences that may require implementation of a weaker design in exchange for stronger subject protections. We also have here the researcher. Of course, the researcher also brings their own strength and limitations to the study. A specific researcher may not possess the skill and competence to conduct a wide range of study types. So we have to bear in mind that there are researchers that often focus on one tradition or even one design or for most of the studies that they conduct. Okay. Another one is, of course, the researcher and the resources. Okay. The resources here are necessary to carry out the study in an ideal way. So the researcher and the resources. We also have here the time frame. The time frame is another important consideration in research design. The length of time available to the researcher from planning to implementation to write up is a critical concern when finalizing design decisions. So you have to take note of your time frame. Number 6, you have here the amount of control. This one, the amount of control the researcher needs in the study provides guidance in the design of the study. And studies that require a high level of control, like, for example, drug trials and intervention studies, will need a high level of structure. And finally, okay, we have here what we call as ultimate audience of the study results. Some clinical fields focus on specific designs. For example, the practice of pharmacy is based on almost exclusively on evidence produced via randomized controlled trials, and the profession of nursing uses a variety of research paradigms to answer questions about nursing care. Yet, even within the profession, some audiences expect specific types of research. Okay, so that is for the audience of the study results. The design decision. Design decision paint the study in broad strokes first, and then into or in one detailed level as the study is planned. Different decisions may be assigned different relative weights, for example, okay, depending on the amount of the structure needed. So we have here, we always say that study design always involves trade-off or trade-offs. Some design flaws may have little impact on the study's outcome, and others may fatally affect the credibility of the results. So I always tell my students that they should be very careful in deciding what particular approach and design will they be utilizing in the conduct of the research. So we have here the three phases, but then again, it is probably unrealistic to think that these decisions as occurring in a particular sequence. Researchers often move back and forth between decisions that are related rather than mutually exclusive. So we have here three phases of decision-making process. We have number one, you have to identify the assumptions or identify assumptions about the knowledge to be gained from the study. And number two, select a design that serves the purpose of the study. And three, develop detailed plan for implementation of the study. These phases start with a high-level macro view of the problem and purpose of the study and hone in on more detailed decisions as the design plan unfolds. Think of these phases as looking at the study with a series of ever more powerful microscopes or focus, or you're more focusing tightly with each subsequent look. Next, we have, okay, select a design that serves the purpose of the study. Once assumptions of the study questions have been determined, of course, the researcher selects an approach that will answer the research questions and meet the goals of the study. And this selection process is a result of a series of decisions based on reflection, of course, on the aim of the study, the concepts under the study, and the nature of the research question. And the researcher could make actually decisions or these decisions by answering series of questions. So we have here what we call as exploratory. Okay, these are often qualitative or mixed method studies, but they may be also quantitative if measurement is employed, like for example, survey methods. Okay? Confirmatory study, when you are after the relationship between variables, and the study is designed to test the relationship statistically while minimizing bias. And this require a careful definition of the variables and concepts of interest so that they could adequately measured and analyzed. Actually, confirmatory studies are often next step from exploratory. For example, an exploratory analysis of responses to a knowledge-based questionnaire administered to patients with diabetes might be used to design specific diabetic education that is subsequently tested for example, for effectiveness. Okay? Next is we have the discussion of what are research variables. These are introduced into a study explicitly to measure an expected effect. Okay. So a research variable may be categorized into two. It may be an independent variable or a dependent variable. So when we say a dependent variable, this is an outcome or the effect, okay, that could be occurring after the introduction of the independent variable, while independent variable could be a factor that is artificially introduced into a study explicitly to measure an expected effect. So this is the cause of the cause and effect. So remember, when you say dependent, this is the effect. And when you say independent, that is the cause. Once again, when you say dependent, it's the effect. And when you say independent, it's the cause. We have here, we have discussed already what are extraneous variables, but then again, we have to reiterate that these variables are factors that exert an effect on the outcome, but that are not part of the planned experiment and may confuse the interpretation of the results. Okay, they are not expected. They are inevitable sometimes, and they are not expected to occur in a research. But then again, they might affect the result of the research. So, what is the nature of the research question? Once the conceptual basis of the study has been articulated, the research question becomes the focus of more specific design decisions, and the nature of the research question serves as the foundation for the next set of decisions that you will be having. Like, for example, the classification of the specific research design. Most research question can be classified into one or four categories. Like, for example, we wanted to ask or have questions that seek to describe a phenomenon or population that is usually done in qualitative research or case research. Okay? Questions that seek to quantify the nature of relationships between variables and between subjects. So these are more of your correlational. Question that seek to investigate causality or effects of interventions or risk factors could be cross-sectional or a case study or a single subject study. You have number 4, questions that determine effectiveness of interventions as evidence for practice. These are the common descriptive designs. You have the survey design again. It describes the characteristic of a sample or event or a single point in time through self-report. And one of the limitations of this one is the inability to determine the causes of change and difference or differences between groups. You have the cross-sectional design. It describes the characteristic. Do you remember that? It describes the characteristic of samples that differ on a key characteristic measured at a single point in time. So one of the strengths of this cross-sectional design is it is uncomplicated and it is economical. You have the longitudinal study, and this one, data is collected from a sample of selected points over time, and these are your prescriptive or your retrospective, and longitudinal is sometimes called as your cohort or panel design. You also have here the case study, and this case study, again, it explores in depth a single individual, program or event or action through the collection of detailed information using a variety of data collection techniques. And you have here a single subject design. Okay, do you still remember that single subject design does not permit generalization to larger populations, but it could be, these are studies that could be in response of a single individual to one intervention based on measurement of a baseline and ongoing measurement after introducing a treatment. Do you still remember that? So we also have here phenomenology, and this could be either interpretive or descriptive or your Heideggerian or Husserlian phenomenology. And this investigates the meaning of an experience. But this again, one of the pitfalls or limitations of this design is it requires a high level of analytic skill. We also have here ethnography, and this one is highly intensive. Okay, that study the features and interactions of a given culture by, of course, immersion in the natural setting over an extended period of time. And again, one of the pitfalls of this one is it might require the researcher to stay or have an extensive contact over time or long periods of time. Another is we have designs that, let me just get back. Okay, design that describe relationships. You have your correlation. Again, the correlation describes the relationship between two variables in a single population or the relationship between a single variable in two populations. So correlation relationship. Predictive study, it describes a relationship between a predictor variable or a group of predictor variables and an outcome of variable. And you have here the grounded theory. Again, this is a qualitative research method in which the researcher attempts to develop a theory out from the study. Another is we have design that examine causality. You have your experimental, you have your quasi-experimental and case control design. So again, experimental designs, it provides the most rigorous test of effectiveness of interventions. Okay, don't forget that. And you have here quasi-experimental designs. It enables scrutiny of causality, and of course, this one could not definitely determine the causality because the level of evidence is provided, or the level of evidence that we have here is weaker than that of the experimental design. We also have here case control designs. Okay, so don't forget that we have also the case control design for the design that examine causality. Develop detailed plan for implementation of the study. So we have here, you have to, a research plan guiding implementation of the study describes the following elements. So we have, of course, the sampling strategy. Okay, you should know what will be or who will be representing your sample. The measurement strategy, of course, you have to know how will you measure your data collection. This should be rigorous. Okay? You should know how to do it step by step, and you have here the data analysis plan. How would you um, analyze your data statistically or in qualitative research? What particular method of data interpretation will you be utilizing in the conduct of the study? Another lesson for tonight is the sampling strategy. So we have here the population. Sometimes the population is, again, no aspect of research plan is more critical for ensuring the usefulness of a study than sampling strategy. So kasi it determines whether the results of the study could be applied as evidence and contributes to the trustworthiness of results. Actually, good sampling is critical for the confident application of the study findings to other people. Don't forget that, and settings or time periods. We have here the population. Of course, this is the entire set of subjects that are of interest of the researcher. So you would know from the start who will be your population. And sample it might be a portion or a carefully selected subset of the population that reflects the composition of that population. So uh, it could be a part of the population. And we also have here what we call a sampling error. So the sampling error is critical consideration in statistical testing, and sometimes it is referred to as chance, or in statistics, I think it's the standard error. Okay? It is the criterion used to determine whether statistical results reflect real effects. And again, it is critical then to use a selection strategy that minimize sampling error. So you have to be very careful in using very good sampling strategy in your research. You have what we call a selection bias, and this could happen in selecting subjects or assigning them into two groups in a way that, I'm sorry for that one, in a way that it is not impartial. So this one, it could be posing, or it could pose a threat to the validity of the study. It could occur in the following conditions or under the following conditions. Okay, the accessible sample is not accurate representation of the population. So, you might have your population, but the sample that you have or the accessible sample could not be enough. Okay, or it could not be an accurate representation of the population. The researcher can influence selection or assignment of subjects. Okay, the researcher could also be having some biases here. And you have here inclusion and exclusion criteria systematically leave out a key group. Okay, so you have you have in your inclusion criteria the things that you will be thinking your as the characteristic of your key informants or your participants or your respondents. But then again, you may leave out a key group. You might be neglecting a very important of the part of the population or the sample. The ease of recruitment varies the population skews subject characteristics. So sometimes you want to use convenience sampling over other sampling techniques because it might be easier for you to finish your study, and the subjects elect not to participate, sorry, or drop out of the study. There are participants or key informants that will tell you that they will just drop out or they will not participate in your study. So what will you do? And for example, this is done in qualitative research. What will you do? You have to, for example, the key informant would say, I don't want to continue, and you have to respect that that's their right. And for example, if they don't want to continue, you have to ask them if the things that they have shared with you could be included in the study or not. And if not, you have to follow the decision of the follow the decision of the participant. Okay. The sample selection strategy you have here, a sound selection of strategy is one of the best ways to control bias in an experiment. Okay, several aspects of this strategy may enhance validity and control bias, and the objective or the use of objective selection criteria and sound recruitment methods is appropriate for all types of research. So this one, the sampling strategy for qualitative research is for credibility and generalizability. That is why um, in qualitative research, Okay, in ethnography, sometimes it is just uh, a group, okay, that you are observing, and in case research, sometimes it is an individual, but you have to um, have that in-depth analysis of one case over time. So for quantitative studies, the use of probability in sample selection or group assignment reduces bias and enhances representativeness of the results. In addition, actually, in this one, subjects are recruited and selected for the study based on the criteria that are carefully considered to represent, okay, the population under study while minimizing the effects of extraneous variables. So in quantitative studies, the criteria are applied objectively, and all subjects who meet the criteria are generally invited to participate. We have here what we call as inclusion criteria. Of course, these are the characteristics of the participants or respondents that you will be involving in your study. And in your exclusion criteria, these are the characteristic that eliminate a potential subject from the study to avoid extraneous effects. Like for example, in qualitative research, we don't include participants who may not want to be interviewed. Okay, we don't force them. Or for example, they might be suffering from post-traumatic stress disorder from the research topic. So you might not want to include them, or they should be excluded in the research. Okay, next. Sampling in qualitative studies, we have here what we call as purposeful sampling. Okay, so in qualitative studies, although objective criteria for recruitment and selection strengthen the credibility of a qualitative study, informants in this type of research are selected from a potential pool of subjects in a way that is controlled and executed by the researcher. So we have here the purposeful selection. So this one, a technique used in qualitative research in which the subjects are selected because they possess certain characteristics that enhance the credibility of the study. So qualitative selection criteria are formulated through a thoughtful reflection on the type of individual who is most likely to inform the research question. Okay? In Tagalog, kung sino yung makakasagot doon sa or makakapagbigay ng experience to the researcher. Okay. We have here stages in qualitative sampling strategy. We have here identify the characteristics. Okay. You have to identify the characteristic of the ideal informants. Who are these informants? Do they possess what are the things that are included in the inclusion criteria? Number two, identify accessible informants. So para hindi ka na rin mahirapan. Number three, determine settings for recruitment. And then four, approach and invite potential informants and then obtain consent. So in qualitative research, even in quantitative research, we have the WHO informed consent in the conduct of the study. Sometimes the advisors would require an NIH certification before the conduct of a qualitative study. But WHO informed consent, I think, is enough for your level. Methods for purposeful sampling. So what are these? You have your typical case sampling. It is used when the study requires two subjects, okay, who have common or who have some common characteristic. Number two, you have your homogeneous sampling. It is used when concern arises that special or outlier cases may skew responses. And this one, take note that this is not usually used in qualitative research. But in qualitative research, since we are using the purposeful sampling, sometimes specifically you have your criterion sampling, used when the study requires subjects who have an experience in common. So this one, for example, you have your COVID-19 survivors. So everyone who suffered from COVID or present in the COVID era could be your participant. You also have your maximum variation sampling. This one, for example, if you're studying about women were selected with a maximum variation strategy, for example, in terms of age, education, occupation, and number of deliveries and the type of delivery. For example, if you are studying about the postpartum changes or experiences of women in postpartum changes, okay? We have here extreme case sampling. It is used to obtain a sample that has extreme target population characteristics. So For example, whether professional training or yung shared decision between caregivers and patients with, for example, neurogenic or neurocognitive disorders, or pwede ka dito kumuha ng half of the caregivers that had in-depth training and the other half is wala talaga silang training. So that is extreme case sampling. Yung for example, meron kang certain case ng patient, ipapahandle mo. Okay, pwedeng yung na-train at saka hindi yung na-train. So pag yun ang tawag natin is extreme case sampling. We have here theoretical sample, an example for this one when I had my study, the nursing Nightingale, and beyond, okay? I have my studies was all about the experiences of nurse leaders in the community, in the academy, and in the hospital. Okay, my theoretical sample, additional sources of data. I also got participants from the uniform personnel, the BFP, the Bureau of Fire Protection, the PNP, the Philippine National Police, the Armed Forces of the Philippines, and other uniform personnel who are nurses and who are in their managerial roles. Next is we have, I'm sorry for the delay. My internet connectivity is not really that good now, okay? Because we have a typhoon here in the Philippines. Sampling in quantitative studies, we have here probability or random sampling, a sampling process used in quantitative research in which every member of the available population has an equal chance of being selected for the sample. So that is a random sampling. When you say random selection, it is a method of for choosing a random sample using mathematical probability. So this one, your statistician will do mathematical computation for you to be able to get a random sample. We also have here what we call as independence, and independence is a condition that occurs when the selection of one subject has no influence on selection of other subjects. So dito, each member of the population has exactly the same chance of being in the sample. So pag sinabi natin simple random sampling, okay, simple random sampling is used when a table of random numbers typically generated by the computer, as what is stated here, is used to select subjects from the sampling frame. This could be sampling frame that includes the entire population that is eligible for the study. So this one in here in some simple random sampling, the researcher must have access to a listing of all eligible individuals who are both part of the population and meet the selection criteria. And the subjects are numbered, okay? Like for example, if the drawn set of random numbers is 21, 11, 143, and 86, then pwedeng yung 21 or 21st, 11, and 143rd, and 86 are subjects on the list would be asked to participate in the study. So ito medyo, this one should be done by the statistician na lang, okay? They will teach you how to do it. For the systematic random sampling, it is useful when the researcher is unsure of how many individuals will eventually be in the population or when there is indefinite sampling frame. So this one, it is also practical way of drawing a sample from a prospective group that is, for example, a group that is drawn randomly and remaining subjects are selected at predetermined intervals. So pwedeng 1, 2, 3, 1, 2, 3, 1, 2, 3. So the third one. That is systematic random sampling. Stratified random sampling, they are structured so that important characteristics are evenly distributed into groups. So such sampling is a good way of reducing the probability of overrepresentation and underrepresentation. When we say stratification or stratified kasi, it is based on some important characteristic that will help the researcher ensure that all subgroups are represented in proportion to their prevalence in the definite or what you say defined population. So this one in a stratified random sample or the stratified random sample are more difficult to accomplish than the systematic or the simple random samples. We also have here what you call as cluster sampling. So the cluster sampling, sometimes it is impossible to draw a single subject from groups. So because of either geographic limitations or accessibility issues. So in cluster sampling, the researcher randomly selects entire groups and then randomly selects subjects from only those groups. For example, an organizational researcher might want to study the effect of care delivery models on patient satisfaction. Yung mga hospital na tinatawag na magnet facilities, instead of randomly selecting subjects from this or all patients care in these units, in all magnet facilities, pwedeng yung researcher would first randomly select magnet facilities and solicit participation. Okay? Para mas madali siyang makapag data gathering. So we have here convenience sampling. So from the word itself, it relies on subjects who are accessible to the researcher. And we also have here the snowball sampling, or the other term is referral sampling or respondent-driven sampling. It is a specific kind of convenience sample that violates both randomness and independence. And this one, each subject is asked to identify or recruit other subjects. So this one of the weakness of random sampling could be compensated for in part by randomly selecting subjects from those who are referred. For example, they are referring you three respondents. Okay, you could randomly select from the three. You could get the two, or you could get one from them. So pwede pa rin makabawi doon sa um, violation niya ng randomness in that part. So this one actually is stages of quantitative sampling strategy. You have to determine or define the target population. You have to know who is your target population. Is it accessible? And then define the sampling frame. So this one, your statistician will guide you on how to randomly select potential participants, and then you have to have inclusion criteria and exclusion criteria, and you will have to know who will be eliminated from those considerations that you have. And then you have to apply random assignment. So your random assignment could be your control group and or your experimental group. And that will be all for tonight. I will see you soon again. Thank you and good evening.